Wernick, and I'm an occupational therapy major.
I'm Alexis Porter, and I'm an exercise science major.
My name is Molly Matthews, and I'm a social work major.
I'm Stephanie Less, and I'm a nursing major.
I'm Teo Kim, and I'm also a nursing major.
And we will be presenting on clinical personal training, which is a combination of clinic rehab and corrective exercise science to come up with fitness plans for clients to reach their optimal fitness goals.
Starting with education, in order for someone to become a CPT, they would need a bachelor's degree, some sort of advanced degree, and a personal training certificate. The higher someone's educational level, the more they can work with the specific special population. What differs a PT from a CPT is the advanced degree, which can be specialized. As for the individual we interviewed, Dr. Huff, she received her bachelor's degree in exercise science and then went back to school and got her master's degree in which she specialized in Parkinson's disease. After she completed all of that, she earned her personal training certificate. In practice, a CPT's roles and responsibilities would include making connections with the client to provide better service, which can lead to one-on-one training sessions, designing effective goal-oriented exercises, deciding appropriate exercises for individuals who may have a certain disability or medical condition, assess if the exercise is working and if the patient has improved, and report productivity to see if any changes need to be made. Performing all of these roles and responsibilities will ensure the best patient outcome. Some of the settings that a CPT may work in, but are not limited to, are schools, hospitals, rehab facilities, physical therapy facilities, geriatric settings, and aquatic centers.
Clients of CPTs, our person we interviewed was Dr. Huff, and she works with patients who have Parkinson's disease and other related diseases. Other patients that CPTs work with are people who recently had surgery, people who want to better their health, people with chronic back pain, hernia patients, cancer patients, patients who no longer have insurance, and there are many more. Interprofessional collaborations include, but aren't limited to, therapists, which are physical, occupational, and aquatic, hospital staff, which are surgeons, physicians, and nurses, primary care doctors, family doctors, and physicians, and trainers, personal and athletic.
Our professional collaborations with CPTs, nurses are the front line of communication when it comes to the patient. The nurse is able to give background information to the CPT, and for example, knowing the patient's attitudes and how they would react to a certain situation would allow the CPT to know their medications and their past history. And when working with a patient, knowing about their past is crucial in order to help them with the specific training they need. Occupational therapists look at a non-traditional way of helping a patient. Since they take a different approach, it allows for the patient and the OT to find the best way to improve the patient's daily living. An OT works hand in hand with the CPT to create a plan of care and that has patients' life values in it. For example, Dr. Huff had a patient that enjoyed horse riding and was then able to put that together with the OT to come up with exercises to work the muscles. They used a medicine ball shaped like a saddle and resistant bands as the reins, as a horse would be. Since both professions were able to work together, they came up with a plan that the patient was able to enjoy. Someone who uses exercise science is very knowledgeable about certain diseases. Knowing in depth about a disease can affect the patient and help them come up with a plan of care. A CPT can collaborate with someone who has a degree in exercise science by coming up with a way to treat and train that patient. For example, someone who has osteoporosis could benefit from someone who understands the disease. A social worker helps the patient get good health care and make sure that they are getting the help they need. They also are able to help patients with different cultural backgrounds so they are comfortable when finding treatment. When everyone understands each other's roles, everyone works more efficiently.
We learned that it is very important to have different professionals work together to provide the best care for the patients. Also, collaboration of social workers, nurses, occupational therapists, and exercise scientists can lead to holistic care of the patients and customized care for the patients rather than a standard treatment. Lastly, we learned that it is very beneficial to have and our professionals work together, since people can benefit in many different hospital settings. It benefits from communication, collaboration, lower risk of malpractice, and patient-centered care. These are our references, and thanks for watching our video.